People like Romney would argue that we're going to lose jobs as a result of this. So I want to get Romney's reaction on the ruling. Let's start off with video number 6.
I disagree with the Supreme Court's decision, and I agree with the dissent. What the court did not do on its last day in session, I will do on my first day if elected President of the United States. And that is, I will act to repeal Obamacare. Let's make clear that we understand what the court did and did not do. What the court did today was say that Obamacare does not violate the Constitution. What they did not do was say that Obamacare is good law or that it's good policy. Obamacare was bad policy yesterday, it's bad policy today.
Okay, this is a perfect example that JR always points to when it comes to student body elections, right? Like, let's say in elementary school, when someone stands up on that soapbox and says, hey, if you elect me as a student council president, I will make pizza available every day of the week. Except you don't have the ability to do that. No. So talk to me, Jacki, a little bit about repealing Obamacare.
Well,
as he says
one of the things that we like to joke about in the morning we think is so fun is every time Mitt Romney releases an ad, it's like day one, part 2, my first 100 days. It's like all of the things he proposes are not things he actually will have the presidential power to do. So he says in his ad he's going to repeal health care. Well, you actually have to go through Congress. You don't have the option of doing that. Or he's going to build the Keystone Pipeline. You have to.
Yeah, good luck with that.
Yeah, everything he wants to do has congressional action tied to it. So these are all talking points.
Yeah.
And none of them actually have any relevance. The other part, and I never thought in a million years I'd say I agree with Rick Santorum, but frankly, he's not the right guy to be arguing against national health care reform because he passed it in Massachusetts. The national health care plan was very much based on what the Massachusetts plan looked like. This is not an accident that this is the outline. There were advisors within the Obama administration who worked on healthcare reform, who worked on Massachusetts reform. This is not coincidentally similar. And for him to stand up there and say with a straight face, this is wrong, this is bad policy, is laughable.
It's so laughable, and it's not just something that liberals can identify. It's something that conservative organizations identify as well. Organizations that are opposed to the Affordable Care Act have come out and said, look, we like his rhetoric on this issue, but we don't trust him.
Yeah.
Because you were in favor of similar legislation. It doesn't make any sense at all. It drives me crazy.
Well, and it also depends on whether or not the Democrats, politically will take advantage of the fact that Romney passed this for Massachusetts. It's kind of unlikely, it seems to me, based on the Democrats' behavior in the past, whether or not they'll capitalize on this to its fullest extent when it's sitting there right in front of them and available to them.
In fact, let's go to video number 8, where he talks about being in favor of the mandate.
With regards to the mandate, the individual responsibility program, which I proposed, I was very pleased to see that the compromise from the two houses includes the personal responsibility principle. That is essential for bringing health care costs down for everyone.
Essential.
Yeah.
He doesn't just like it, he loves it.
What is it with the Republicans? Do they not understand what videotapes do? Or do they not understand how YouTube works? Now, this is in 2006, so it wouldn't, faze me if he didn't understand how YouTube works.
I think they're going to be bold. I think they're just going to be bold, bald-faced, say, no, we didn't say that. That whole Etch-a-Sketch thing, that is what I think the plan is going to be.
It's so bizarre. I mean, it's just human nature. It's like you said it, it's out there. I mean, even before the day of an age of YouTube and internet virality, I guess it is.
Virality.
Is that a word, virality?
I don't know.
It's my new word.
I like it.
Look it up.
I hope it sticks. All right, finally, let's watch Romney talking about how the Affordable Care Act is going to harm Americans.
Obamacare raises taxes on the American people by approximately $500 billion. Obamacare cuts Medicare by approximately $500 billion. And even with those cuts and tax increases, Obamacare adds trillions to our deficits and to our national debt and pushes those obligations on to coming generations. Obamacare also means that for up to 20 million Americans, they will lose the insurance they currently have, the insurance that they like and they want to keep. Obamacare is a job killer. Businesses across the country have been asked what the impact is of Obamacare. 3/4 of those surveyed by the Chamber of Commerce said Obamacare makes it less likely for them to hire people. And perhaps most troubling of all, Obamacare puts the federal government between you and your doctor. For all those reasons, it's important for us to repeal and replace Obamacare.
So there were a number of lies in that video. First, that we're going to take money out of Medicare, you're going to lose your Medicare. 20 million Americans, I believe he said, are going to lose their health care coverage. Except, first of all, we're expanding Medicaid so that 17 million Americans will qualify for it. People living in poverty who cannot afford insurance. So I don't know where he got that number from.
The Chamber of Commerce, who clearly wrote his speech.
Yeah, absolutely.
The speech brought to you by the Chamber of Commerce.
So let's focus on the Medicare aspect of this.
Well,
what is he referring to?
What he's referring to is that we grossly overpay Medicare. It's one of the flaws in our system because we have Medicare that the government provides, and then we have Medicare Advantage plans, which are administered by the private health insurance industry, and they get reimbursed by the government. They also add in all sorts of fancy extras, and they overcharge the government by a lot. So part of the Affordable Care Act will cut the overpayments to Medicare, and that's part of the savings. That's part of the way we're paying for this act in general. Originally, when they set up these plans, the insurance company said, we can do it better. We can be more efficient than the government. Let us do Medicare. And these Medicare Advantage plans have proven time and time again to be more expensive. So when they talk about taking the money out of Medicare, it's actually the waste and fraud that we spend overpaying the private insurance industry for the same things that you can get through your regular Medicare plan. They just add in fancy extras like, I think it was gym memberships and things like that, which seniors are not using enough to qualify. I mean, not all seniors. I don't want to, to justify rather. I don't want to get angry letters from seniors who go to the gym.
So what they're really cutting is the waste and the abuse in the Medicare
the abuse,
system.
and the fraud.
How dare they?
Yeah.